So I'm Sue Sharples. I'm based in Lancashire. I'm one of the directors of the Unite group, which is a user-led group. We have self-advocates, family members, people who work in services, working together to promote the importance of relationships and sexuality in the lives of people with a learning disability. I suppose I can only say that I love it. I absolutely loved it. When I saw it, I was just kind of almost jumping up and down, Gary. I was so excited because anything that raises awareness and brings together some of the things that the self-advocates that I work closely with have been saying. They've been saying it for years. Sadly, this isn't new stuff. This is stuff that everybody knows, that relationships are important, that love in people's lives is important. And I very rarely hear it talked about in adult social care. We don't mention the word love. And yet, if you ask anybody what's important in your life, they say relationships and love. And so I cannot ever get my head around why we miss it out. So I think the document is absolutely brilliant because it talks about love, it talks about relationships, but it also is very practical in that it's suggesting that we can't do this on our own. We need to bring together everybody. You know, the self-advocates have said, and we need to listen to what people are saying to us, that we've missed this out. And how are we going to move forward? But we can only move forward by everybody working together. It's about commissioners thinking this is important. It's about everybody in health and adult social care thinking this is important. Family members, self-advocates, mainstream services, all coming together. And we really need to start, as the document says, by raising awareness. So talking about it more at conferences, everywhere we go. I never stop talking about it. You know, I do this 24 hours a day now. It's the only thing that I focus on. And I still meet lots of people who are saying, well, you know, we're not doing anything about this. And I realise how important it is now. So I think the more this document can be waved about and shouted about, the better. And for us in Lancashire, it's what we've been saying, and it's just wonderful to hear Learning Disability England, a national organisation, taking this up, because now we've got a funnel to work with, you know, and we endorse it. I think we immediately said, you know, we support the document, we want to be involved in it, and we'll do anything possible to make sure that some of the plans that you have happen. The short answer to that is no, they don't, and there are lots of reasons for that. And I know that the work that that you've done with self-advocates, Gary, has shown that services generally put barriers up, and there are reasons for that. There are real reasons that we need to consider. We know that particularly around sex, it's a taboo subject in our society, so generally we don't talk about it. And the people who work in those services, you know, have been affected by that. So there is a lot of fear, there's a lot of embarrassment around talking about relationships. We also know that services generally are very much focused on safeguarding, and that causes restrictions. Words like love and relationships and sex do not figure very much in those things. So those barriers actually don't keep people safe. We know that if people have loving relationships, they're actually safer. So sometimes we're kind of working against the aims and objectives that services have. However, I would say that there are more and more providers who are thinking about it. They are trying their best to address some of these barriers, and they're doing things like providing training for self-advocates, providing training for staff, making sure that they have policies in place. But they do tend to be in the minority. The first thing is to acknowledge that we're all human and we all have the same needs, and that isn't necessarily happening at the moment. So we have to raise awareness, we have to start talking about relationships more, we have to raise the priority of relationships in people's lives, and we have to we have to make sure that people are accountable for that. So some of the things that the Good Lives document talks about, which is, you know, making sure that CQC are asking questions about relationships. So one of the things that the group in Lancashire did was contact CQC and say, you don't really talk about relationships very much. We sent them 9 questions that we wanted them to ask as part of their inspections, and they are now in the sex and relationships guidance at CQC.